All right. So hello, everybody out there in social media land. I am Dr. Kent Key, and this is the Flint Public Health Youth Academy with our partnering organizations, Black Millennials for Flint and WOW Outreach. And we are so excited to talk to you today about some wonderful things that our young people are doing right here in the city of Flint. Before I get into it, we want to first thank the sponsors and the supporters of our camps we're going to thank some of the past sponsors and the current sponsors. So we want to thank, shouts out the Community Foundation of Greater Flint. We want to give thanks out to Flint Recast. They have sponsored us in the past. We want to also give thanks out to the Black Millennials for Flint. We want to give thanks and shouts out to, who else, Dr. Bailey, am I missing? It's been a couple others. Youth Quest, they have sponsored us in the past as well.
And the Flint Health Coalition.
Greater Flint Health Coalition, as well as Mock College, who has partnered with us and who's giving us the use of facilities for this year's summer camp. So again, our young people are doing wonderful, wonderful things in the city of Flint. And we have some dynamic young people we want to have them introduce themselves. So we're going to start off with our participants for this year that are on. I just want you to just tell the people your name, your age, and what grade you're in. After that, we'll have our FPHYA interns introduce themselves, interns and mentors, and then we'll go to our partners from Black Millennials for Flint and from WOW Outreach. So I'm gonna start off. I'm Dr. Kent Key, founder and director of the Flint Public Health Youth Academy, and we're gonna just pass it. So I'm gonna call Nevaeh, and then you're gonna call somebody's name, and then we'll do the popcorn pass that way. All right, Nevaeh, tell us who you are.
My name is Nevaeh. I'm 13, and I'm going to the 7th grade. And Princess, you can go.
We can't hear you, Princess. It's connecting the audio now.
Hi, my name's Princess. Anyway.
We'll work out those. Y'all must be near the same room or something because we're getting feedback. That's okay. So Princess is here, and then we're gonna call Damani.
Hi, my name's Damani and I'm 9.
What grade you in?
4th.
All right. And now you pass it to Isaiah. Call on Isaiah.
Isaiah.
Hi, I'm Isaiah Grays. I am 16 years old and I'm in the 11th grade.
All right. Now we want to go with some of our interns. I'm gonna call on Amir in my upper right corner, and then you pass on to other interns.
Hi, hello, my name's Amir. I am currently about to be a senior in college. I'm helping out with the camp, and I'm a FPHYA intern for about 3 years. Let's see, who else should I pass it to? I'll pass it to Cruz.
Hi, I'm Cruz Duhart. I'm a senior English major at Morehouse College, and I've been a FPHYA intern for about 3 years as well. And then I'm going to pass it on to Kayla.
Hello, everyone. My name is Kayla Shannon. If you hear a noise in the background, it's my godson. He's loud. And I have been a member of FPHYA for 2 years, and I attend the illustrious Spelman College in Atlanta, Georgia. I'm currently a junior. And yeah, I'm glad to be with y'all today.
And Kayla will tag Taisha.
I'm so sorry. I'm getting my stuff settled down. I just got home. Hi, I'm Taisha Brady. I'm going to be attending Mock Community College for Sign Language Interpretation. I've been at FPHYA for a little bit over a year now. And yeah.
Great. And we'll go to our mentors, starting off with Khalil.
I'm Khalil Calvin. I was formerly staff, but now I'm a mentor. I think I joined with FPHYA in 2018, so it's been 4 years. I'm currently a student at Morehouse School of Medicine, so I had to take a little step back from that, but glad to be here.
Great, and then Faiza, sorry.
That's okay. Hi, my name is FPHYA. I just joined as a FPHYA mentor this summer, super excited. And I'm a third-year med student at Michigan State University.
All right, Marcus.
Hello, everybody. My name is Marcus. I am a Michigan State undergrad student, double majoring in human biology and neuroscience for minor in cognitive sciences. This is week 2. So I'm brand new, but it's been fun looking at the camp. It's been fun. So thank you for having me today.
All right, and then we got Kiera.
Hi, everyone. I'm Kiera Wallace. I've been a mentor for 2 years now, I believe. I am a third year at University of Maryland School of Law. And what else are we saying?
That's it. And you're Flintstone,
okay.
from Flint, made in Flint, came from Flint, mind and heart still in Flint, right? All right. And then we're going to move to our staff. So Monisha.
Hi, I'm Monisha. I'm one of the staff. I've worked at Michigan State since 2017, and that's when I started working with FPHYA.
And that is Dr. Monisha. All right. And then who did I messing out on the FPHYA end? Dr. Bailey.
Hi, I'm Reverend Dr. Sarah Bailey, and I've been with FPHYA since before FPHYA, so glad to be here.
And so for those of you that have been watching us since the inception of our talk show like 3 years ago, you know that FPHYA, we believe in creating a village. So our part of our extended family are the Black Millennials for Flint and WOW Outreach. So I'm gonna start off with Michelle. Go ahead and reintroduce yourself. She's been on a couple of the last shows, so y'all might know that face. Go ahead, Michelle.
Thanks for having me back. Hey everyone, Michelle Mapson here. I'm a scientist by training, and I am the Chief Advocacy Officer and co-founder for Black Millennials for Flint. I've been with the students this week, but I'm back in DC for now, back home with one of my cats. The other one is around here somewhere. And let's see, I attended Howard University for undergrad, the University of Michigan for my dual master's, and I'm currently a doctoral student at Johns Hopkins University in the School of Public Health.
All right. And then Carlton.
Hey everybody, my name is Carlton Poindexter. Currently I'm a doctoral student at the University of Maryland in environmental science, and I'm a former lead prevention ambassador, the DC lead prevention ambassador for Black Millennials for Flint, and I work alongside Michelle. And I was also there at the camp this week and had an amazing time.
Great. Then we got our WOW partners. Deshelle, say hello to the people.
Hello, people. My name is Deshelle McDonald. And yes, I am the administrator at WOW Outreach. It was funny as you guys were going through y'all resumes, I'm like, we'll be here a while. So I'll just say I've run several businesses over the last 20 years. I've transitioned into outreach with my dear sister, Kenyatta Dotson, about a year ago, full time. And I have been moving around the neighborhoods with Adele and Kenyatta, and we've been just making moves. So it's really nice to be here and nice to introduce these youths to the Young, Gifted, and Green. It's been awesome. But that's me. I can be here all day, like Dr. Bailey said.
And then we have our wonderful partner, Kenyatta Dotson from WOW Outreach.
Hey, everybody. Good to be here with you today. My name is Kenyatta Dotson, and I'm a part of WOW Outreach, been a part of FPHYA forever, been connected to Dr. Key forever. And Dr. Bailey, love her so much. And I'm so happy to be a part of the young people's lives. So I am a graduate of Michigan State University. I'm a social worker by profession and also just all the way around. And I'm also a doctoral student at Ashland University. I should be graduating in December, Lord willing. So thank you all so much.
All right. So there you have it, everybody. This is the FPHYA family, our extended family, our village, right? And we come together because we care about young people, and more importantly, we care about the young people in Flint and Genesee County. And so this year's summer camp is focused on environmental health and environmental justice. It's entitled Young, Gifted, and Green. Environmental Justice Academy. So we're just so excited to talk and to share with you all about what we're doing, what we're gonna do, and maybe what we may have in the future. So we're gonna just kind of dive right into it. I'm gonna serve as the facilitator for this show. And so I kind of wanna first just invite you, any of you, to kind of talk about not so much our camp in particular, but the importance of having youth enrichment activities, especially in the summer, for our young people to stay engaged. I know growing up for me, we had like the King, Chavez, and Park summer camps where we went to different colleges and stayed in the dorms and all of those things. But what it did for me, it kind of exposed me to higher learning and to the possibility of higher learning. But just anyone that wants to jump in, how important is enrichment activities for you as youth, and or how important has enrichment activities for you as an adult been when you were youth? Marcus, I see your hand up.
So hello everybody, once again, my name is Marcus. So some enrichment programs are like really essential for growth and development. I've been on it on both sides. I've been a student, and that's why I've been a peer mentor. Like this summer, I helped about 200 students come into Michigan State throughout 2 weeks, just transition, and just looking at their faces from the start of the week when it feels like a whole boot camp to the end when they become family. It's like, it's really heartwarming, but two, you just understand you gave them so many resources and opportunities that they wouldn't have had just a week ago. So just by being there for them, being that voice, being that inspiration for them, and having them get to their potential destination, that's what summer enrichment is about. It takes you out the house and it allows the student to really come into themselves and learn more about themselves, because that's what we're trying to do at the end of the day. Like we do have a curriculum, so we do have things that we're trying to like enforce and to implement. But when a student like, oh, I really love this, and they become passionate, that's when you're like, I did my job. And that's like the biggest thing about summer enrichment on both sides, by just being there for that student, allowing them to open up and to become them. And then that satisfaction of, wow, the student's loving this. I can do this next year and the next year. So that's what it is. Like summer enrichment is really essential, truly.
Thanks, Marcus. Anybody else? Amir?
Well, me being physically there and just seeing all the kids interact with each other and be able to solve problems out like together, as a unit, it's pretty great to see. And just, from me and the age ranges from all the way from 9 to 17 is very, very, I think, crucial, because also what's going on in Flint as a whole right now, as far as, the whole Ajax plan and all that stuff being built up, right? It's up to them, well, up to us as young people, to really bring a voice to that and really kind of challenge that and to make sure that people have a better quality of life and make sure, kids aren't being harmed, adults aren't being harmed alike. So I think it's really good to enforce all these values and principles into them and really know about public health and really understand it, and then also help them in their education. So yes, great.
Thank you, Amir. Anyone else want to jump in?
Yeah, as a mother and living in the Flint community, just keeping our youth engaged and learning and becoming and coming into themselves is very important, because I'm not going to always be around and they have to be able to handle themselves. So it's really nice to just see them open up to different things so that they can learn who they are, so they can become great or have a chance to.
Thank you. Anyone?
Yeah,
go ahead.
Add to that. What's special as well is that you can learn certain things that you wouldn't necessarily learn in school. Through those resources and those opportunities, you can find new aspects of things that you weren't necessarily interested in before, but all of a sudden you are now because you've been exposed to it.
Thanks, Cruz. Anyone else before we go to the next question? Dr. Bailey?
It's not only an opportunity to be exposed to new and different things, but it's the opportunity to be exposed to new and different people. You get a chance, this is an opportunity to meet people that in your normal everyday life, you probably would never meet, you would maybe walk past and never even speak to, but now you get a chance to meet them up close, personal, and you find out that you know the real Dr. Keith.
It's a joke behind that. Those in social media land, it's really it's a joke behind that. All right. Dr. Bailey got everybody calling me the real Dr. Key, and it's like, really? I'm real. I promise. I'm flesh and blood. So then my next question is, now I'm bringing it more specific to this summer camp, right? What has been you all's experience so far? We're only in week 1, and we got to do week 2 next week. But as facilitators, as planners, as organizers, as participants, what has been your experience and what has been the most impactful for you?
So I've been in the room a lot with the kids, and from the first day to the 4th day, it was just the light turned on in them and what they've been learning. And it's really interesting to see them learn the theory this week. So I'm looking to look at the practical when we go out to the field on Monday. So it's really, and this guy who claims he's sleepy right now, but he's sitting still, he want to go jump on a trampoline, he's really been enjoying it. So, and I'm really amazed to see the what's the word I'm looking for, y'all? The steps he's made so far. And just being there. And I appreciate you guys even allowing him, being 9 years old, because he's the youngest in the class, to be part of it, because it's really gonna take him a little further as he go along in life. So I appreciate this.
And while we still got him before he get on a trampoline, Damani, what's the thing that you've learned the most out of being a part of the camp? What's one of the things you think that was the most impactful to you?
That people should not throw lead in water, and that lead can travel through air. And when people throw lead in the water, it affects pipes, then lead come out the pipe.
All right. Look at Damani. Isaiah, your hand is up.
Yes, I found it quite rewarding to learn about different disparities that people of color face when it comes to the environment. And I loved learning how policy and the environment can go hand in hand. So that was just really rewarding to do this week.
Great. Anyone else? Participant? Michelle.
Sure. So as one of the facilitators this week, I just have to say, if it wasn't already obvious, I am not an educator per se by training. I'm a scientist. I'm trying to translate information the best I can, but these topics are deep. It's taken me years and years to learn. And I am just so impressed by how quickly and thoroughly the students have picked up this work. I'm glad that I think the sessions have been recorded. I mean, if there's any way to compile some of the talking points and the things that we're discussing, I mean, folks would realize how deep we get. And I just enjoy being able to hear the responses, the things that come to mind as we're having conversations. And it's not lost on me that a lot of what we're talking about is very heavy. You know, some of these are very somber topics because we're talking about people's health. And unfortunately, the ways in which our health is not always prioritized in this country. And so it's, again, it's not lost on me that that's a lot to be doing on the summer. But I think that what's endearing is we try and keep it fun, try and keep it light. I love the creativity that y'all have brought into the space as students and thinking and through these topics and how we can solve them. So again, I'm just impressed and I can't wait to come back on Sunday to start on Monday with y'all. This is our first year as Black Millennials for Flint doing this work from a youth perspective. And we couldn't be prouder to be partnering with FPHYA and WOW and other groups. And I'm just ready to see it, keep building up for next year. But again, like y'all have made it a lot easier for me because this is not my trade to be teaching in this way, but y'all are picking it up. So can't wait to see what we have in store next week.
Thank you, Michelle. I see Amir's hand.
Well, me just being there and like getting supplies, being in and out and stuff like that. I can tell that the kids are very, very active and engaged and they want to learn this. Like I can tell that they soak in all the information. And it even took me a while to, learn the stuff when I first joined FPHYA about 3 years ago. It took me a while to learn the information and they just been getting it and getting it off the bat. And I mean, it's really incredible to see that. and just like me playing games with them and stuff like that, just learning the material, you going over them. They just get it lightning fast, and it's very, very great to see. And also, hopefully, off of this camp, they can tell their friends about this, and then we get more people, more youth involved, which would be great. And just keep the train going, you know. So,
anybody else?
I think what's been most impactful for me has been like seeing the connections that we're able to build with one another, like doing this in community with one another. Is what makes it most impactful. It's the fact that it's not just the effort of Dr. Kent Key, the real Dr. Kent Key, or the efforts of just WOW, or the efforts of just, like, it's the fact that I feel like so often in movements, people try to move alone. Like they try to stab the beast at one area. And I appreciate that we're all able to work together in this work, that it's not an individual contributor, but truly like the village coming together.
Absolutely. Absolutely. Anyone else? Carlton?
Yeah, so as a facilitator this week and my first engagement with the kids, honestly, like I said, blown away. Similar to Michelle, giving them this information about environmental justice, as unfortunately a lot of them have already been exposed to, and really having building context around it, and how quickly they can already think about how does this affect our community. And with this program, going out next week to look at the asphalt place and take those pictures and see how it's impacting the community that way, it's just astounding. And we live in this age of so much information, and so I love to see how they're actually coming in with this information, wanting to build on it. And then the best part is that we, our community and our kids have such a unique perspective and way about, articulating this information, and just seeing them working together and piecing how they're going to present this information. Me and Michelle and everybody else is giving it to them, and they, interpret it, and they have their understanding that they're going to share with their friends and honestly with the rest of the world. And so that part is just astounding. And I had so much fun with them, and it was just like an honor, just like watching the next generation, watching the next wave of game changers.
And I think also because FPHYA is a public health focused piece, which is like an umbrella for mental health, for physical health, for social health, for environmental health, for so many different aspects of what health is. It's more than just physical health. But then partnering with Black millennials who do a deep dive into environmental health, right? I mean, they take that deep dive, and then partnering with WOW, who has always been, Kenyatta has always been doing marches against violence. And this is violence. Environmental injustice is violence against communities. Communities are victims, right, to the violence that happens. And so I just think it's a perfect marriage and a perfect blend of organizations that are really coming together. Kenyatta, are you on a plane? You look like you on a plane. I want to fly. She's gonna roll her eyes. That's so funny. Anyway, but I just think it's a perfect marriage of what it is that we all bring, and we all have these different levels of expertise. Some is overlapping, others do it a lot deeper, but I think it's just a wonderful thing. Some of the students in FPHYA who have not been a participant of this camp, but you were a part of previous camps, right? And the FPHYA curriculum is pretty much consistent, but then we also add other components, other modules, like Cruz and Amir. When you had your first camp, and what I mean by that camp, it was really the summer enrichment program we did at the city of Flint. And you guys went through the curriculum and you guys did some grant writing. What were some of the things that stood out for you that you didn't know before you were a part of the camp?
You want to go first, Amir?
Yeah. Well, so personally with me, I just thought, that was crazy, just wrapping my head around all the information being given, and just all the really startling facts that I learned off of you teaching us that information, and just how widely this environmental problem has been reaching across communities across Flint, the water obviously, and then them building different plants and factories, so on and so forth. it was just kind of overwhelming at first, but once you get it, you really felt determined to really do something about it and try to change it. And I think the information, I still remember the information that you gave us from like 3 years ago. So like, it definitely sticks in your mind when you get it and when you understand it and can comprehend it. It really makes sense and it all fits together in like a puzzle piece. So yeah, that's what I got from it.
Thanks, Amir. Cruz?
Yeah, one of the things that stuck out to me the most is how wide scale public health is. For something that doesn't get discussed enough, or at least now in this new day and age, these last couple of years, it's been discussed a little bit more. But before then, it was like, there's this whole community and concept that's really integral to how our society functions that doesn't really get spoken about. You know, you hear a lot about medical doctors and what that is, but, you know, when it comes to things like costumes and things like that, there's not really a public health costume. And so engaging with the, you know, the learning, I was able to find about all these different types of things that, you know, obviously make sense, but before then had never been introduced to me. But one of the things that I really garnished from it is that public health really connects with almost every field and being that you have to do as a human. You know, when it comes to policy or just simple things like growing up in Flint, you see certain things and then you understand after learning about public health, this is exactly what it connects to. You know, without having people who are professionals in the field in some of these meetings and some of these discussions, decisions will be made that aren't necessarily good for your health. And so it helped me realize that, you know, at every level, there needs to be someone engaged with or someone who understands some of these type of things that can help provide and assist and look out for people. And that's really what, you know, really stuck with me is public health is about looking about for people and showing concern that, hey, this is something that we can do to change and uplift and potentially help people. And, you know, I learned all of this before the pandemic. So when I, you know, experienced the pandemic, I was like, oh, all these dots are connected. These are exactly the things that I learned about. And so I really appreciate that, you know, FPHYA is going out of their way to teach youth so that, you know, as they get older and become more of an adult, they understand all these, how like these systems work and, you know, how they impact them.
Great, thanks. So for the participants from this summer camp, what are some, tell me one of the things you learned this week that to you may have been new, or maybe it made things make more sense for what you already knew. So who wants to go first? Nevaeh, Princess, Damani, Isaiah?
I'll go. Actually, it was learning about research that really resonated with me from this week when you broke it down of observation and question, hypothesis, experiment, analysis, and conclusion. You know, I research, but I never broke it down to that extent. And so it was rewarding to get that this week, and that resonated with me, and that's gonna stay with me for the rest of my life.
Wow. Anyone else? So real quick, I'm gonna put it this way. So our participants, who can tell me what a chronic disease is without having your notes in front of you? What's chronic disease? Go ahead, Nevaeh.
A disease that stays over a long period of time, something like that?
A disease that happens over a long period of time. And we have examples of stroke and heart disease and diabetes for that. Princess, you remember what infectious disease was?
A disease caused by organisms.
And give us an example of one.
COVID,
yeah,
or monkeypox and rabies and so on.
Yeah. And Damani, what's the difference between a medical doctor and a public health doctor? Do you remember?
Yeah, a medical doctor only helps one person at a time, and a public doctor helps more than one.
Okay, exactly, a community or population, absolutely. So as we coupled public health and environmental health with what we're going to do next week, what did y'all learn about environment this week through what Michelle and through what Carlton was teaching us? Go ahead, Damani.
Well, Mr. Carlton was teaching
We
us.
put a Mr. on there. Go ahead.
Mr. Carlton was teaching us how paint like comes off the walls, and when the paint comes off the wall, then it travels through the water. Then when the paint, like when people put toxic paint on the walls, it like the paint comes off and starts going to the water.
So you're talking about lead exposure through paint. And so for many of you all in Flint, we had a lead problem before we had a lead in water problem. And a lot of communities historically, especially poorer communities, had lead-based paint. Absolutely. Anyone else want to share anything? And I'm not just talking to the participants. So if some of the facilitators, the observers kind of want to chime in, feel free. And mentors. And I'm gonna put somebody on the spot because this was FPHYA's first time being there. So FPHYA, what was your reaction as you observed how the young people responded to Michelle and Carlton and to FPHYA's curriculum and what we were teaching?
I think it was just really cool to see such young people get so invested in learning about each specific topic that each group was assigned to make like their TikTok about. Everybody was super engaged. Like nobody was really sitting there, like not really, trying to do anything. Everybody was really engaged. Everybody was coming up with really fresh ideas. They were asking questions. One of the groups I got to talk to started asking what happens when, pregnant women can't get transportation and can't get to the doctor, like what will happen to them, what will happen to their baby. And that was a really, really cool. And that was a question that came about because of what their topic was. Their topic was, how does climate change affect Black maternal health? So that was a really interesting conversation we got to get in. We got to talk about, the mom has to go to the doctor every, couple of very specific number of weeks so that the doctor can make sure that, the baby is developing the way it should. So we got into that conversation and that was super cool. But I really liked seeing on my first day such young people really committed to, environmental justice in their community. It was amazing.
He give you a round of applause. So let's talk about some of the activities to the participants. What were some of the activities this week that you really enjoyed? Because you guys did several different types of activities, different games, different, mapping, looking at maps and all of those things. What were some of the activities that you really enjoyed this week so far? Isaiah, sorry.
I actually like designing a city with my group. That was just really fun we created like a clean energy city. That was like really, really fun to do. And then I don't want to take another one. I'll let someone else answer.
Damani and then Nevaeh.
I like when we did the TikTok with Mr. Carlton.
All right, the TikTok. And eventually at some point, we're going to have all those on our social media so you all can see them. For Black Millennials, for Flint, FPHYA, and WOW, we're going to make sure that we blast those things so that young people can see what other young people can do with their platforms. Nevaeh?
I like when we played that game. I forgot what it was called with you. It was fun.
The Cahoots game?
No, the science game where we had to get the questions and stuff.
Oh, so that CDC game where we went on this global mission.
CSI.
Yeah, and we became global epidemiologists to really learn and to solve some issues around some new diseases and viruses that were breaking out. Go ahead, Princess.
I liked it when we did the Kahoot. When we reviewed, I just like reviewing over what we learned. That's my entertainment.
Thank you. Anybody else?
I'll just say I love the cities that y'all designed. Y'all really got into it. I could see myself in each of them, including Damani, y'all and the superheroes, you and Alan, making sure y'all have superheroes and community gardens. Yes, that. Yeah. Okay. But in the clean energy city, of course, and then Ohana family, y'all really just, again, went off around saying, this is where we want to live. What does your ideal community look like? And I feel like it's going to tie in really, really well to what we see in terms of that's what we want. This is our reality. And the principles of environmental justice, which I think a lot of you all really took to and really kept connecting back to, you'll see like the principles themselves are kind of our foundations. This is what we want to see. They're all about justice for all of us. And really the kind of communities that you all created embody the principles of environmental justice. So again, I'm just continuing to say that I am impressed. I should also say, because I did end up having to post the TikTok that Bonnie, Allen, Ayana, and a few others did. It has about 2,000 views. It's not on TikTok, excuse me, it's on Instagram Reels. So yeah, y'all, I don't know if that's considered going viral or not, but folks are really enjoying it.
It's trending.
And it's trending, okay? So folks are really enjoying, and that topic was on the lead crisis in Baltimore. So again, Damani kept bringing up like paint on the walls, getting into the water, getting into our bodies. We can inhale that's happening in Baltimore. Y'all are really, again, showing us what you're learning. So it's really awesome.
Carlton?
The TikTok videos, not only just because the information that they portrayed, but again, allowing them like an avenue to see all their creativity, watching them come together. Because every group, we had 3 different groups, and every group did a TikTok, but it was so different, and information was presented in such a different manner based on that group, so that anybody, if we to watch these videos, anybody can like this one, or they like that one. And so that, and also as I was working with the groups and talking to them, one of the big things when we talk about environmental justice, and even when we want to talk about public health, is how the factors and variables are like systemic. And so watching them read their various case studies and really start to think about, oh, these people don't have jobs. These people also don't have transportation. So when there's a natural disaster, they're stuck. Or with the pregnant women, they, like we're saying, they don't have access to healthcare because of floods or because of heat. Now they're stuck. And watching how all these different pieces are playing a part in, environmental justice as well as public health and how they're intertwined.
Absolutely. Anyone else? Dr. Bailey?
Well, I didn't do a whole lot of it, but I know that it's extremely important with these type of jobs in public health and environmental health to do self-care. And we had a bit of self-care this week with yoga. We want to thank Jasmine Hall, who has a yoga studio here in Flint, for providing us with introductions to yoga.
Absolutely. Dashelle or Damani?
It's me this time.
Okay.
One of the things that I'm big on is health, nutrition. And one of the first things we learned on the first day was what is public health and what are some of the things. And it was one of them was the food. And that really made me feel great because I always push their vegetables and push they get a square meal and fruits and things. And that just helped to instill that better into them so that they can understand why mommy is pushing the good foods, because without your own physical health, you ain't gonna be no help to nobody else. So that's one of the things that, I really enjoy seeing just the confirmation on things that mommy has taught to her kids. And also I teach that to my students because we have a beautification project going on this summer where we actually have our own garden. So, I really enjoy this. It's all tying in together. So
it's cool.
It's cool, says Monty.
So I did notice a lot of the youth love the global health activity that we did, which is an interactive game in partnership with the CDC. But there was also, and of course they love the TikToks, right? That's like total expression. TikTok is still a hot thing with young people. But there was an activity Michelle did that stuck out with me. And I just want to ask the youth, when she did the mapping up there and she was able to find Flint and to show different places where churches were and where, hazard dumping sites were, and then we can find out how many, what the age groups are, what the racial demographics are. How did you all react to being able to see that? Like she's literally just pushing buttons and showing us everything that we've been living in. Like that, to me, I love those types of things. How did the mapping things resonate to some of you all participants? Go ahead, Damani, you got your hand up. That's how he do in class too. He be the first with his hand up. Go ahead, Damani.
I learned that it's not that many it's a lot of hospitals in red instead of yellow. Yellow has some, but red has a lot because it's 95 to 100. There's more hospitals in red than yellow.
Right. And Michelle can explain some of that too, but what he was saying is that in certain neighborhoods, there are lesser hospitals than others. And then depending on the geographic location, it kind of tells you how many people were people of color versus non-people of color. I mean, and he's remembering all of those things and it's sticking to him. And he's 9 years old. Like, I'm loving this. Go ahead, Isaiah.
Seeing it, it was quite disappointing to see how some communities were not treated like others. And it just really makes me more passionate about getting involved because I just don't understand how in a nation of such wealth that we can have one area that looks one way and just drive even just like 3 miles and see something that is completely different.
Absolutely. And that's something we've been doing for years with FPHYA, talking about, the next predictor of life expectancy outside of your genetic code is your zip code. And Michelle's ability through that technology to kind of just go over from Flint to Grand Blanc or go from the west side to the east side. And you even pulled up life expectancy, didn't you, Michelle?
Yeah, so sorry, Dr. Bailey, I'll just let this just to kind of put an explanation on this. So the EJ screen mapping tool is a project that the Environmental Protection Agency developed over the years to show what we call environmental justice indicators. So the environmental hazards that might be in our communities. And then you place that on top of census data. So this is data that's already being collected across the country about our racial demographics, where we live. They're also collecting health indicators like folks living with asthma, life expectancy, which can vary like even up to over 20 years, just a mile or two down the road, as Isaiah was saying. So you can start to see that the conditions folks are maybe living in we saw a lot of highways near areas where there was more asthma. We know that we started to learn that could be related to the trucks causing pollution in communities. And then you start to see folks having asthma. We learned that all of us, in fact, either know someone or are touched by asthma personally. And this mapping tool starts to visualize that. So if you're more of a visual learner, it's excellent. Damani, you're right on thinking about the red and the orange. If you have more red, that's not so great. Because that means that there might be a more negative indicator that's being highlighted in that particular part or community. We were even able to zoom all the way out to Baltimore and show some similar occurrences. So really wherever you see, and this is what with Black Millennials for Flint, our work is around showing like in Black and Brown communities, we're a lot of times dealing with some of the similar things. So we need to be coordinated. We need to be thinking about these things, as Carlton said, as the systemic ways in which they exist. And the students, like y'all really pick that up. You're able to show and see like just this one tool based on where we're gonna be next week at Ajax, you'll be able to see that on the ground, like what are the things we learned on the map and how does that manifest and what does it look like on the ground? So we'll come back to that next week because I think it's a really powerful tool and it might even be a good part to include for the photo boys. Like we can create a map and print that out and have that information display for folks so they really, really get it.
Thank you, Michelle. Dr. Bailey?
Yeah, I was just in tandem with what they were sharing there. I was going to say that Dr. Key and I just presented before the Genesee County Board of Commissioners. And we used that tool to talk to them about the social determinants of health and how this happens in neighborhoods and that you can go maybe 3, 4, 5 miles and the life expectancy is predictable based on what your zip code is. And this is something that we've been looking at for, I would say, the last 30 to 40 years of how this really goes through communities of color. And really, it's very mind-blowing. And the fact that the kids got it a whole lot easier than what the adults who actually provide, who actually do the governance in this community was extremely encouraging, because that means that the younger you are when you start to understand these things, and will give you more time to start working on them. So I'm very encouraged, and I was encouraged the whole week, because normally you see maybe about in a class, maybe about, if you're really lucky and you're really a great presenter, you will get maybe about 75 to 80% engagement. But when you walk into a classroom and the class is 100% of all of those there are engaged, that is mind-blowing. You guys did an awesome job of keeping them all engaged the entire week. I mean, all the way up. And most days we went over a little bit and not one kid complained about us going over the time.
Yeah. And Michelle kind of segued into photo voice. And so we're definitely excited about what we're going to do with the photo voice project. Maybe after we complete the photo voice project and do our gallery, we'll do some pictures and make a virtual gallery, and maybe even share on one of the talk shows what comes out of that. So, you know, again, we're really excited about this work, about young people, about Flint, about public health, about environmental justice, you know, and really about people being able to live their best life in the most healthiest way possible. And so we're just excited about this. So before we get ready to wrap up, Isaiah made a statement. We do some touch base with all of the students, you know, every day or at the end of the day, every couple of days, we got to get feedback from them. And he made a very good observation when he was talking about how he felt this needs to be in schools. So Isaiah, tell us what you said, and then I'll also pull in, I think it was Princess that also said something about it. Go ahead, Isaiah.
I was talking about how I really loved what we were learning, and I thought it should be taught in schools. And so my school has an ACC committee that does the curriculum on a 7-year cycle. And so I've contacted the board president of the Board of Education about doing a curriculum study. So I'm in contact with the vice president of the Board of Education. And so we're going to try to work on that and see if that's possible.
And that's a Grand Blanc school. So that's what we're talking about when we're talking about action. And then I know Princess, I believe she said, because a lot of the students said they never learned nothing like this in school. And then Princess, I think you're in a different school district, but you did learn similar stuff, but you said not that in depth. Go ahead, Princess, just tell the people what you meant by that.
Yeah, so.
That means, Deshelle, you guys have to mute.
Okay. Yeah. So I've learned a lot of this, and I like that I learned it. Like it was in some of my history and some of my English. Like I learned it in almost every subject, but it wasn't as in depth as this program is. It was more knowledgeable. Like you can actually do, like what we're learning right now is photo voice. Well, somewhat. And this Monday we're going out to do it, I guess. Like to do that, what we learned in the world, like in a real life situation. So yeah.
Yeah, they call that real world situations or experiential learning. Absolutely. All right, so I want to kind of, as we prepare to kind of, you know, transition, Dr. Bailey, Carlton, Michelle, FPHYA, Kayla, who's been there, Marcus, you've been there virtually, and Monisha, do you all have any parting observations that maybe you just kind of want to talk about, or anything you want to lift before we transition? And I'm asking them because it takes a lot of work to organize stuff like this. It takes a lot of dedication. It takes a lot of coordinating, and even with the curriculum, sometimes, you know, you may get a group of students who are more advanced than the last one. So on the fly, you got to modify how you say things and how you present things, you know, in real time. And so just any observations or any parting comments before we transition off? Marcus?
My big observation throughout the week was this engagement, and then it solidified that just today. Like, I don't know if y'all know that I was smiling a lot. Really, I was impressed by all the students that are here on this call. Just the retention of what they learn, and then how they're applying it into, or trying to apply it into their real life. That, in essence, is the big observation. Like, people are coming, but people are leaving different than when they came, and it's only week one. So week two has a whole new adventure for these students, and that's what is really making me proud. Even though if I was virtual, I was over here and everything virtually, but like looking at it now, just after week one, that's the biggest impact for me. Just seeing the love for it and the love to make it work. So that's my big observation.
Anyone else want to share? No pressure. I'm just.
I'll just quickly say, I know Princess mentioned this earlier about liking the review. It's just really awesome seeing how much of the information is retained. Like, we will quickly go back through topics, and I know for certain that through these couple of hours that we get to spend each day, that the information is sticking. So that is just really, again, impressive. I keep saying that, but it's just awesome to see that. And I'll be, again, really curious to see what comes of next week when we're doing more of that experiential learning, like on the ground, and get to pool this project and everything that we're learning all together, while also we're going to introduce some more topics next week. So excited to introduce that to y'all on fashion and climate change, sustainability, natural disasters. So some really cool topics on top of the Photo Voice project that y'all are going to get to learn. So, and I really love what was just mentioned about like seeing y'all like come in one way and then leaving with what you've learned in a whole different way. So, and then also the relationship building, like I can tell that there's a lot more, like everyone's a lot more comfortable with each other. And so I really do love that.
Anyone else? Carlton?
All right, so lastly, I think, when Michelle and everybody was telling me about the program and developing the curriculum, it's, at a first glance, it looks really challenging since we have such a wide age group with students, from high school students to some of the younger ones. And so trying to, weigh out, how do you explain things like you were saying, what will be the best route to get the students to understand, and even watching as we're presenting our information and engaging with them, but also just seeing them in the down periods, or like outside when we're talking or when we're trying to have fun, they're explaining it to each other. And I think that's the most amazing part about that. And even I would take 1,000 Damanis, he's the youngest one in our class or in the program, and he's on it. He knows what he's soaking it all in. And so seeing everybody, seeing Isaiah, seeing Princess, seeing Nevaeh, all understanding it, to taking all the information, talking to each other, really explaining it to one another. That I think that's the greatest part of working with the students, and watching them not only taking it for themselves, but really helping each other and building that camaraderie. And as we talked about earlier, the best parts about these programs is now they have this, they're building their network with making these friendships and these memories with people they wouldn't have that contact with normally.
And I'll say this, on one of the downtimes, most of the downtimes, we are totally blown away with the conversations that we hear. But the last downtime, they literally went to court and created a mock trial session where we had a bailiff, a judge. And the thing about it, with such a wide range of age, everybody engaged. And we don't see the older ones making the younger ones feel like they're not, old enough. It is really amazing, which also makes me think, we're going to have to really do some public health and law and public health and policy stuff, because they literally took us straight to court. Environmental health has a lot to do with stuff that we have to fight for court. Look what just happened. I think it was in Virginia with the EPA verdict and those types of things. This stuff is real, but they just literally are doing these things that are social change type of activities and topics. And it is just so exciting. So I will end us here by saying, first of all, thank you all, our partners, our participants, our mentors, our staff, everyone that has made this camp thus far a success. We're excited about what we're doing next week. Again, the goal of FPHYA is to engage youth to the point where they consider careers in public health and or understand how to connect whatever the career path they go into to public health. And now partnering with Black millennials also to consider environmental health. The beauty about this is that we've made science fun. We've kind of taken the stigma out of science. Like, this is science. We are scientists, and we are now passing the torch to future scientists. So this is, and future scientists of color, which we know there's a huge disparity as it relates to that. So I'm just geeked, I'm excited. I came right off a plane, tired from the West Coast, and I just, tunneled through the first week, and I'm just so excited. I'm not gonna rest until after next week. I know self-care is important, but I'm just so excited with what the young people are doing. I don't wanna miss anything. So again, thank you all, everyone out there in Radio Land. This has been another episode of A Youth Perspective. Again, we're talking about our summer camp, our wonderful young people who are really looking at the impact of public health, really the intersection of the public health and environmental health, right? And then looking at how we then use policy to change those things. And so we're excited. Thank you again. We'll be here Friday after next, same time, same place. Again, remember, public health is everything, and everything is public health. Have a good evening, everybody.